Have you ever wondered how one tiny injection could dramatically transform someone's life? For millions around the world living with obesity and type 2 diabetes, the answer lies in a new class of therapies: GLP-1 receptor agonists and the revolutionary dual GIP GLP-1 agonists like Tirzepatide. This isn't just medicine, it's a breakthrough in metabolic health. Today, we're diving deep into the science, the benefits, and the real-world hope these therapies offer to patients, to doctors, and to families searching for a better life. Let's begin this journey together. What are incretins? Incretins are like secret messengers in your gut. They signal your body after a meal to lower blood sugar and control appetite. The two key players? GLP-1 and GIP. What is GIP and how does it work? Let's now talk about GIP, or glucose-dependent insulinotropic polypeptide. Like GLP-1, GIP is an incretin hormone. It's released from the small intestine after we eat, especially in response to fat and carbohydrates. Its role? To help stimulate insulin release when blood sugar levels rise, but only when needed. Interestingly, GIP may also influence fat metabolism and play a role in how our body stores energy. However, in people with type 2 diabetes, the insulin-boosting effect of GIP is often blunted. That's why, until recently, GIP was overlooked in treatment. But now, with dual agonists like Tirzepatide, GIP is stepping into the spotlight as a powerful partner to GLP-1. What are GLP-1 receptor agonists? Imagine a hormone in your body that knows exactly when you've eaten, one that gently signals your pancreas to release just the right amount of insulin, helps keep your blood sugar in check, and even quiets your hunger. That's GLP-1. GLP-1 receptor agonists are designed to mimic this natural hormone, offering not just glucose control, but a powerful aid in managing weight and metabolic health. They slow down how quickly food leaves your stomach, reduce your appetite, and calm down that sugar-raising hormone, glucagon. It's like giving your body back its rhythm, one step at a time. Examples of GLP-1, GIP, and dual GIP, GLP-1 agonists. Let's take a closer look at the key players in this new generation of metabolic therapies. First, we have the GLP-1 receptor agonists, a well-established group of drugs. These include exenatide, liraglutide, dulaglutide, and semaglutide. They've been used for years to help control blood sugar in type 2 diabetes and support weight loss. On the other hand, GIP agonists, those that act solely on the glucose-dependent insulinotropic polypeptide, are still under active research. As of now, there are no widely approved GIP-only drugs available for clinical use. And then comes the innovation: dual GIP GLP-1 receptor agonists. The star in this class is Tirzepatide, marketed under the brand names Mounjaro and Zepbound. This powerful combination targets two metabolic pathways at once, delivering impressive benefits in blood sugar control and weight reduction. These drugs are reshaping how we think about treating both diabetes and obesity. Mechanism of action of GLP-1 receptor agonists. GLP-1 receptor agonists work in harmony with your body's natural processes. They mimic the GLP-1 hormone that regulates your blood sugar, helping your pancreas release insulin when it's needed most. But that's not all. They also quiet the liver's production of glucagon, preventing excess sugar from being released into your bloodstream. This means you have better control over your glucose levels. As they slow down your stomach's emptying, they make you feel fuller longer, helping curb your appetite. This complex yet elegant mechanism helps you manage both your weight and blood sugar with one simple approach. Pharmacokinetics of GLP-1 receptor agonists. Pharmacokinetics refers to how the drug behaves in your body. GLP-1 receptor agonists are unique because they have a long half-life, allowing for convenient weekly dosing. These medications are given as subcutaneous injections under the skin, which allows for slow absorption into the bloodstream, providing a sustained therapeutic effect throughout the week. Unlike some other medications, these drugs don't rely on your liver for breakdown. Instead, they are excreted by your kidneys, which can be helpful for people with liver concerns. Indications for GLP-1 receptor agonists. GLP-1 receptor agonists aren't just for one condition. They are versatile tools in modern medicine. They are primarily prescribed for type 2 diabetes, helping patients manage their blood sugar with precision. But that's not all. These medications are also showing promise in weight management, making them a powerful ally in the fight against obesity. Moreover, studies are exploring their potential to reduce cardiovascular risks, which is vital given the high connection between diabetes and heart disease. And beyond that, researchers are investigating their role in treating liver conditions like NASH, where liver fat builds up and leads to inflammation. Efficacy and benefits. In clinical studies, they've shown a remarkable ability to lower HbA1c, which is the long-term measure of blood sugar control. For people with type 2 diabetes, this is life-changing. When it comes to weight loss, these medications deliver strong results, with many patients losing a significant amount of weight, often beyond expectations. And the benefits don't stop at blood sugar and weight loss. These treatments have demonstrated improvement in cardiovascular health, lowering the risks of heart disease and stroke. The key here is sustainability. These medications provide long-term benefits that go beyond just a quick fix. They're about creating lasting changes in your metabolic health. Side effects of GLP-1 receptor agonists. As with any medication, GLP-1 receptor agonists come with their own set of potential side effects. Some people may experience nausea, especially when first starting the medication. This usually fades over time as your body adjusts. There's also a small risk of pancreatitis, which is an inflammation of the pancreas. It's something doctors carefully monitor, particularly in patients with a history of pancreatic issues. If used with other blood sugar-lowering medications, there's a potential risk of hypoglycemia, or low blood sugar. And although rare, animal studies have shown a potential risk of thyroid tumors. Clinical guidelines for GLP-1 receptor agonists. Clinical guidelines recommend GLP-1 receptor agonists for patients with type 2 diabetes who struggle to control their blood sugar despite lifestyle changes or other medications. They are also a key option for individuals with obesity, those with a BMI of 30 or higher, or those with a BMI of 27 or higher, alongside conditions like high blood pressure or high cholesterol. In high-risk cardiovascular patients, these medications can play an important role in lowering heart disease risk, and emerging evidence suggests they may also be considered for treating NASH, especially in those with liver fibrosis. Comparison of GLP-1 receptor agonists. When it comes to GLP-1 receptor agonists, there are several options available. For example, liraglutide and semaglutide are two of the most commonly used medications in this class. The great thing about these drugs is their flexibility in dosing. Some are taken daily, like liraglutide, while others, like semaglutide, are taken just once a week, making them easier to incorporate into your routine. Each medication offers similar efficacy in managing blood sugar and aiding weight loss, but their side effect profiles can differ, which is why it's important to work with your doctor to find the right fit for your needs. In the realm of obesity management, GLP-1 receptor agonists have shown impressive results in clinical trials, helping many people achieve significant weight loss. They work by reducing your appetite, making you feel full sooner and for longer periods, leading to a natural reduction in caloric intake. These medications aren't just for short-term use. They are safe and effective for long-term weight management, especially when combined with healthy lifestyle changes like diet and exercise. One of the most exciting benefits of GLP-1 receptor agonists is their positive impact on cardiovascular health. Studies have shown a significant reduction in cardiovascular risk for those taking these medications. This includes a lowered incidence of heart attacks and strokes, which is particularly important for patients with type 2 diabetes, who are at a higher risk for heart disease. In addition to reducing these events, GLP-1 receptor agonists can improve blood pressure and cholesterol levels, further reducing the overall burden on your heart. The research on GLP-1 receptor agonists is still evolving, and exciting new developments are on the horizon. Ongoing studies are exploring their potential for treating other conditions, like Alzheimer's disease, which could open up a whole new realm of therapeutic applications. There's also growing interest in combining GLP-1 receptor agonists with other diabetes medications to create more powerful treatment regimens. Most notably, researchers continue to focus on the cardiovascular benefits, understanding that heart health is a major concern for those with diabetes and obesity. Starting a GLP-1 receptor agonist regimen is a process that requires careful planning. Doctors typically begin with a low dose to help minimize any side effects, such as nausea. Once your body adjusts, the dose is gradually increased to the optimal level. The medication is administered through a simple subcutaneous injection, which many people find easy to integrate into their routine. Regular follow-up appointments with your healthcare provider are essential to monitor your progress and adjust the treatment as needed. While you're on GLP-1 receptor agonists, regular monitoring is key to ensuring the medication is working effectively. This includes keeping track of your blood sugar levels, as these medications work directly to control glucose. You should also pay attention to any gastrointestinal symptoms, such as nausea, and report any unusual side effects to your doctor. Additionally, routine checks for kidney and liver function are important, as these organs play a role in metabolizing and excreting medication. To wrap up, GLP-1 receptor agonists are truly a game-changer in the management of type 2 diabetes and obesity. They offer a promising array of benefits, from regulating blood sugar to promoting weight loss, and even improving cardiovascular health. With their ability to provide a safe, long-term solution for managing these complex conditions, these medications empower patients to take control of their health in ways they've never been able to before. Thank you for joining us on this journey through the science and hope behind GLP-1 therapies. We appreciate your time and curiosity. Stay informed, stay healthy,